Now, as we think about side effects, there are a number of ways in which we can think about the range of side effects that antipsychotics are associated with. And this is one such grouping that's useful in terms of understanding the impact of these side effects on an individual's life. So, as one thinks about activating side effects include things like restlessness, difficulty sleeping, agitation, anxiety. So these are, quote, hyper kinds of side effects. Then you've got the sedating side effects such as sleepiness, drowsiness, dullness, fatigue, lethargy. You've got a whole range of cardiac and cardiometabolic side effects. You've got sexual side effects. You've got extrapyramidal side effects. So as one thinks about these side effects, as clinicians, we tend to focus on safety issues, such as the cardiometabolic side effects. Patients seem to think, when we think about patients' experience of side effects, we think of side effects that are uncomfortable, that might lead to non-adherence. What we do not fully recognize is that these side effects, in fact, have significant adverse impact on the ability of the person to function. They have a significant adverse impact on the person's ability to lead a maximally productive and meaningful life. As one thinks about extrapyramidal side effects are associated with an increase in cognitive symptoms, further impairing the individual's ability to process information, in a timely manner, to pay attention, to focus on tasks at hand. Extrapyramidal symptoms increase negative symptoms, and so the person's ability to be motivated, to have social drive is adversely impacted. Their ability to communicate emotion, perceive emotion is adversely impacted. So as one thinks about EPS, it's not just the movements, if you will, or it's not just some degree of discomfort that might be caused to the individual, but there is a significant impact on the person's ability to function effectively. As one thinks about activating side effects are associated with decreased ability to pay attention. They're associated with increased paranoia and the sleep difficulty that goes along with these activating side effects also further adversely impacts the individual's cognition and ability to function. Then one thinks about sedating side effects. Sedating side effects, as each one of us can recognize, when we're sedated, when we're somnolent, our ability to think clearly, to process information rapidly, efficiently, is significantly impaired. We certainly focus on cardiovascular and cardiometabolic side effects. That is something we pay a lot of attention to, and we focus on the safety aspects. But if you think about weight gain, for example, weight gain is associated with a decreased sense of self-worth. It's associated with difficulty establishing intimate relationships. And then as one thinks about sexual side effects, that's an important part of our lives. And so sexual side effects, principally related to prolactin elevation, although there are a number of different mechanisms that can that can cause sexual dysfunction, they have an adverse impact on one's sexual life, again, which is a very important part of an individual's ability to lead maximally productive lives, to lead lives of great meaning. Now, as one thinks about the range of side effects and their impact on an individual's ability to function, the thing that we don't talk much about and we have relatively little information about is the actual impact of these side effects on an individual's ability to function, on different aspects of their life, on different aspects of their life that they consider meaningful and important. And so in this regard, I'd like to share with you the results of a survey that we conducted to evaluate the impact, the frequency of side effects, and their impact on persons' lives, the ability to function as perceived by patients themselves.